And welcome back. Well, as we age, our faces lose volume. In fact, we start to lose the so-called baby fat starting in our 20s. But take a look at this before and after. There are ways to restore that youthful look so that you can feel like yourself again. Today, easy cosmetic treatments to help us get the volume back. Dr. Deborah Manjoney is with the Wisconsin Vein Center and MediSpa. She's here with different options to help you decide which filler might be the right one for you.
Right.
Good to see you.
Nice to see you.
I love this. I think it's disheartening every time I hear something about, like, oh, you start losing this in your 20s,
Yes,
you know?
I mean, 20s seems to be that age, the golden age, but after that, it's all down.
Decline. That's right. And not only do we lose it in the face, we lose it in our hands, in our body,
Right.
even our internal organs.
Yes, certain of the internal organs lose volume, like our lungs. And, you know, it's just interesting that we lose volume everywhere.
And this fat, what is the purpose of it? It's supportive, right?
It's absolutely supportive. So it supports your skin. It just gives you, more of a youthful look. And so the things that happen as we start to age, one of the first things we see is actually the skin isn't going to be as plump.
Yeah.
And that's one of the things we always are trying to restore with different techniques that we have using light to build collagen and things like that. But if you look at this image, it's really the volume or the fluid around the cells in the skin. And so it's that little purple line up above, first in the 20s, and then the first thing you lose is the skin starts to shrink in. So it starts to compress and it's not as good. And then little fat pads, the actual fat pads in the face move, and then eventually they drop down. And so the fat is not in the position where you want it. The face is really a lot more skeletonized because you've lost all this fat. And those are the things that we see with age. Even bone starts to get resorbed in your body as you get older. And
it's
so
rude,
these are things
aging.
we can. Well, it is, but I don't have a better solution.
It's true. But this solution is good because those spots that you're talking about are your temple,
right?
Your forehead, your cheeks.
That's exactly right.
So how do we make it look like it's being reversed?
Filler has come a long way, as we were just discussing before this segment. That when we first started out, we were filling like the nasolabial fold, the lines between the nose and the
those
corners
parentheses.
But now we're starting with the mid face and the upper face. So the temples, for instance, you can look at me. I've lost volume in this area. That can be revolumized very gradually with very, very minimal injection. And then the mid face, very important because it actually lifts and it resupports the skin. And so we're injecting much more deeply in those areas down to the bone. It's really painless to do this, and very little chance of bruising in this area.
Okay.
Because we're
when
right
done
on
by
the
a
bone.
skilled injector.
When done by a skilled injector. But also we have, I think, all seen some people who are overdone.
Yes.
Especially in Hollywood.
And that's what people get afraid of, because we don't want to look like everyone else, and we don't want to look like someone else.
You want to look like yourself.
Yeah.
Exactly. Just like you were maybe 10 or 15 years ago, if possible. And so we do look at the face and we try to put it in thirds and just revolumize where people need it. But the volumization lifts the skin, makes the skin look less sagging. We can look here, the chin recedes. And so in this one, we did some injection in the chin.
Yep.
And so we actually brought the chin more forward and gave her a much more youthful appearance by doing that.
Interesting. That's not someplace I would generally think about filling in.
And here, there's the eye troughs were filled.
Yes, you can
and
see
so,
that.
she was hollowed around the eyes, and by just doing a little filler there, it really, again, it just restores that more youthful appearance.
I think it's great, and I think the earlier we can start, the better, but obviously you can work with a more aged face as well.
Yes, we can. But, and starting, we don't mean to start really early because you don't want to change your look, although a lot of people find that their lips may be the first thing that starts to diminish, and so just plumping them a little bit to make them look more hydrated is important.
Oh yeah,
and so, by getting rid of some of the lines on the lips, just by filling it a little bit, we're not trying to give you great big Daffy Duck lips or anything like that.
Nothing in the tabloids.
No, and but at the same time, we can give you a really pretty lip appearance that's your lip. We're not changing it, we're just improving it.
Yeah, and it does. It looks very natural. It looks very even. How about here?
And this is the cheeks. So there's just some injection in the cheeks to elevate and just so you not have that drawn, tired look.
That line underneath her eye is gone away.
That volume in the cheek and the mid cheek now has been replaced.
Yeah.
And same thing here. And this actually improved not only her cheeks, but also the under eye appearance.
Yes.
And so what we're trying to do is restore the natural contour of the cheek to give you what we call an OG curve. It's a very nice, gentle curve, almost like a curl on the cheek instead of being flattened. And we also see effects, as people from sleeping positions. If you sleep on your side, you're going to lose volume more on that side.
on the
of
side
your
you
face.
sleep on.
Yeah, and you may have sleep lines and things, so you may want to, that's why it's
Change up your
important.
sleeping.
It's important to look at somebody and actually look for symmetry and look at what somebody needs just to restore what's necessary.
Well, and I think, as I mentioned, the important thing is to find someone who's skilled. You have some of the most skilled injectors.
Right, they're master injectors, lots of years of experience, very well trained and retrained.
It's incredible. And things can lead to aging, yo-yo dieting, excessive sun exposure, hormonal changes, being too thin, things like that. So make sure that you stop in. Make an appointment at the Wisconsin Vein Center in MediSpa. They're right in Pewaukee, 262-746-9088. Bring in a picture.
Sure, bring in a picture, and this month, any filler you have, no matter how many syringes, $50 off every syringe of filler.
Fantastic.
So the more you need, the more you'll save.
And I like the fact that you don't have to ask for a certain kind of filler. You'll talk to somebody,
absolutely.
You'll look at the pictures and say, this is what I think would work for you.
And a very natural appearance.
Love it. You're fantastic. Thanks so much, Deb.
Thank you, too.